That some people lose their sense of smell and taste after getting COVID. Now scientists have a lead on why. A new study suggesting it's in the genes. Researchers say there's a genetic risk factor and that it increases the likelihood of at least the loss of smell. More women than men report losing their sense of smell, and it seems to affect more people with European backgrounds. Joining us now is Dr. Dale Kalina, infectious disease physician at Joseph Brant Hospital. Thanks for your time tonight.
Hi, Marilla.
All right. Is this something we're still hearing about, COVID patients experiencing a loss of some senses?
Yeah, so the sense of smell and the sense of taste are still one of the symptoms that we see a lot. Of course, with Omicron, we were seeing a lot more sore throat and headaches, but still a lot of the lack of smell and lack of taste is very common.
Makes sense then that there could be a genetic factor from what you've seen?
So there's certainly a lot of things at play here. And I remember from early on in the pandemic, one of the studies that I read suggested that there was more of a neurologic approach to it rather than just being in the cilia and the nose itself. Although in this study that you've referenced, it kind of turns it on its head. It says that there might be a little bit of a genetic link, but at the same time, it also alludes to the fact that it might be more to do with some of the fibers, for instance, in your nose and how you actually smell things.
Yeah, so I guess we'll have to wait for something more definitive to come down the pipe. Quebec and Ontario both indicating now that they could be at a plateau stage for COVID-19 cases. Do you agree with the numbers you're seeing?
So the numbers are still astronomical here in Ontario, and in Quebec and BC, I'm hopeful that the numbers are starting to slow down. What we are maybe starting to see here and maybe across the country is that the rate at which they're going up is starting to decrease. So hopefully we will get to that plateau soon, but really we're seeing so many people. I was on call for the past 2 weeks at our hospital, and the numbers of COVID patients that we saw every day was astronomical, and people really are drowning under the numbers and the volume of COVID patients, not just here in Ontario, but across the country.
Give me an idea of the people coming in. Are they older? Are they immunocompromised? We know a lot of them are unvaccinated.
You know what? It's a mix. It is a huge mix of people. We have people who are unvaccinated and vaccinated who are coming in. We certainly see people who are unvaccinated have more symptoms and are more likely to require a lot of the medications, or more likely to require things like oxygen support, as opposed to the people, particularly those who've had 3 doses of a vaccine, tend to have quite mild symptoms. So those people tend to come in with exacerbations of other illnesses that may be related to COVID, but tend not to require as many of the medications specific to COVID therapy as we've kind of grown to use over the past year.
Let me talk about BC for a moment, because although, as you said, they still have high numbers there, they are going to reopen gyms with some limits. But the suggestion from Dr. Bonnie Henry is that people be 7 square meters apart. So if you're exercising in one spot, the next person has to be 7 meters away, which seems excessive.
It seems far, but when we're seeing people that are becoming sick based on really kind of remote exposure to COVID, it makes a lot of sense to really distance yourself. And I really liked what she said as well, is that very strong recommendation to still wear a mask when you're exercising, particularly if you're indoors. I mean, if you're in Vancouver or Victoria, maybe you're going for a run outside, maybe you're exercising outdoors. But if you're inside, really do try to wear that mask as much as you can. And any more that you can wear that mask and any farther you can stay from other people, that will really help limit the spread of disease.
Dr. Kalina, appreciate you joining us tonight on the program. Thanks for your time.
Thanks, Marla.